2020 was a very historic year. That was the year that the COVID-19 pandemic caused a lockdown, total economic lockdown of activities around the world. But it's also a very significant year in Nigeria. It was the year that hundreds of Nigerians came together, decided to take action actively in their communities to make our hospital work. On the 15th day of June 2020, a formal launch was made of the MakeOurHospitalWork Campaign. The MakeOurHospitalWork Campaign is a citizen-led, community-based advocacy geared towards making sure that health facilities get to work from the primary healthcare level, secondary healthcare level, up to tertiary healthcare level. And it emphasizes community ownership and citizens' participation. In 2021, the Open Society Initiative for West Africa offered a grant worth $49,171.75 United States dollars to Talk Health Niger. This grant is to support the strengthening accountability in primary healthcare amid COVID-19, SPAC. The objectives of the project, which was developed using the principles of the MakeOurHospitalWork Campaign, and of course the grantee being Talk Health Niger, with the MakeOurHospitalWork Campaign as a key implementation vehicle. In trying to achieve all of this, we went to town, carried out a number of activities. And one of them include sensitization of primary healthcare facility staff, as well as inspiring communities to set up health committees. The sensitization activities were meant to bring to the knowledge of these communities the provisions of the World Health Systems Policy and the National Health Act 2014 on the roles of communities in primary health care. They got the message, they took certain actions, and I'm sure you would want to know what they've done.
Really, the community is really health conscious. And we noticed the need for a committee to help us in managing the health system. That informed our decision to set a committee that can be overseeing the activities in the health center. The committee, among other committees, is about the most functional. First, they give us health information. They enlighten the populace. They mobilize the people to come for, immunization and other health concern activities here.
Nde wanyi o ihe kuru oroja na aru ni bie na buri bie de nkom. Ai na roa. No to my nato. I think kodem ai ja na agbale nemi.
Where the health center is situated at is a rented house. And since after your visit, we've been able to intimate the community over the development that the landlord of that house is quitting the health committee out of that health center. So as we are talking now, the house behind me is where the WDC, the committee, is now striving at the community to put into proper renovation. And if you get inside there, we have been able to do the ceiling, did the plastering. Inside the hall, there is a heap of stones ready for flooring.
Ihe agbaneme na health center, ihe omeru di otutu.
We have been experiencing that causing creeping animals to embarrassing people. Based on that, the villagers now took it upon themselves to ensure that the environment is kept in it. 2, they have been encouraging the health committee to always supervise the places to ensure that there's a health facility kept in order. And of course, last year early this year, the community fixed zincs, the broken zincs, they were all broken breeze. They took them away, and the louvers taken away by unknown persons, the beds broken.
Na onwanyi banye do kwike. Ni na even mere hanji ye kpani ha mo he se he center se odisi mo sa anyi nwete na anwenu na do no mve eno na eja ibio ni be ndi osa na word oma na word 1 ndi anwenu bụ na ndị enwe health center ya bụrụ even akwa anya na anụ mgbe aka anyị bidoro na even do ka 800,000 anyị tiekwara na ya ebekwa ava anyị bịakwa bịa mee meeting nke ọnwa asatọ ma nnara even do ka 1 million anyị tiekwara na ya.
From time this health center was established, it was self-help project. Even the equipping the place was a self-help project. So it has been the child of the community to have this place as you can see it now. The seats you can see inside this place was donated by the welfare of Amuro, and they have been assisting in providing some materials that will enable the place to function.
Mgbe mmadụ na-anọga kawa na-abịa sọ ọmụnwa n'ibie na-achọ ndị m nọga n'akwakwa debe duru n'akwa mgbe emekọta ka afụtakọta na ibie n'ihu ibie senta dị na-ajụ ụka ndị ayọ dị ga onye lara n'ezinụlọ nwa ọ ndị ọbụla nọkọta nwa n'ibie na-anụ ọ gịnị kpatara unu abịaghị na ibie ba na-amụnwa unu na-eje n'akwakwa je na-amụnwa n'ọdịghị ma asị mma na-abịa kawa anọ mbụ anyị kpakọtara m legi nke ihe dị na the community siwo unu bịata je bịa ba amụje nwa n'ibie n'ihe na-emeko
ife mba ọdịiche ndụ na ya bụ na mgbe anyị enwebụ ndị health committee na anyị ama n'ụlọ ọgụ uru ndụ n'ife anọgọ ọha n'ihi na uru ndụ na ya bụ na anyị ama n'ọnya bekee na-enyeje ọgwụ se enyeje ndị obodo nọọ mgbe onwe ndị bekee nduere ha bịafute anyị bụ mgbe ha mere anyị mara na bekee na-enyeje ọgwụ se enyeje ndị ime obodo ma ndị ime ma ụmụ egerema amụrụ ọvụ ma ndị ọgaranya n'ihi na mgbe mbụ na anyị anọ n'ụwa abịaje na anyị na-eweje na ha na n'oke ọnụ anyị agbararị moto sụsa anyị jee eka ndụnye enu na-eje kenye naanị ọnụ anyị mgbe anyị bịa nwee kọmitii ha bịa kọwatara anyị ya eme anyị bido bịa je na health center anyị enyere anyị.
When we found out that the government cannot even carry us along, we have many MDGs in many places, but none of them is being found in Namata. They couldn't do any for us. We don't have anybody to speak for us. And it seems as if the government is forgetting the whole of Amata community, which to its importance, we were able to make it possible for us to rent a place. And we have been doing it until we come to a point where we understand that having a health committee will make a very good progress to us. And which after that, we made and we had our health committee. And since the beginning of the health committee, we have been working assiduously to make things through the work of Talk Health Niger, which brought us into a limelight. Now, we can see many progress which I have done. If you could come to our town hall, you can see the progresses that we have done.
Anyị n'onwe anyị mbụ the committee anyị bịa na-enye na weekend very important nyere mmadụ niile and you go some back. And by the case of one of the village yet, I know the community chairman or so, and you can in the Banya, Pasala Wiki Obodo. Chairman is some Bologna committee. I know committee man, you're going to call so, Sanyi to make and you say, whatever never. Because name boom nature, and you will not have the first one, but I'm boom nature. And you band them so that every can you go on Kendi also. And you go to GCK, you on the mother of time. Can you live one jogo? Otoni man, body committee, body village committee, bo vice chairman and bo one jogo, not one jogo family. And you go as you go so many Kenya, you keep it yes. I'm not wishing what I use.
The community looked at the health condition of its members and they viewed that health posts should be very close to them because as people say, health is wealth, and to build up the health consciousness of our people.
This place is a place, hall. The community uses as a hall. But when we heard of this development, Talk Health Niger, that makes us happy. And then we decided to cut part of the hall to make it a health center, and the community has accepted. We decided to contribute money to make the place conducive for patients, for the health technicians, so that we can work from here.
Nsogbu anyị na-enwe n'ihi enwe health post do anyị iche n'ọka nkọ n'ihi na ga anyị bụgba onwe anyị o nwere mgbe ụfọdụ ọkachasị ndị ọgaranya anyị enwe mgbe BP ga-egbago nke mmadụ ọrụ na ọma ikwe na-emo ejibeta masị onye ọma ada mgbe n'ikwe ọma ikwe anyị kwamebe ekwe kemgbe ana anyị bụ onwe anyị na kemgbe anyị nọmara na anyị bịakwara ma bịa jikọba onwe anyị ọnụ na-asụ na maobodo 1 naira ma 2 naira ma anyị na-achịkọba enwe ọnụ were na-enye kata adọsọ na ọganihu.
Naanị nwere mkpa dị iche iche a gosiri nte se ma bed ma ụmụ ife ọzọ niile ji eneta mmadụ n'ụlọ ọgwụ anyị chọrọ se ha nyere anyị aka na ya sa anyị nweta anyị na-ayọ gọọmenti se ha nyere anyị aka.
Because here we need to have a medical doctor that will be taking care of things here, who can be coming on, let's say, weekly times, just 1 or 2 times in a week. Or even if we have any serious issue, we can just call on them to come and help us. We need quarters, that's for the staffs, to build quarters where they can live here, because some of them comes from their place.
We, the community, try with the contribution of men and women. So, so now, on the more no that you can will help. Like Senani will help. Menkodo in this form. I know your government, state government and federal government, they should tender justice with mercy. They will let them look into our problem.
Eka ya sumo mebihiri. Freezer arụsịghị ọrụ. So omezu ụfọdụ na osi n'ihe meriwo ni ka wa bịa ọrụ na ọ na-eje ma ụpata ọgwụ bịa na friji adịghị. Nemewo kawabia ho yoburi bo ode ihelete ehun ode uzo buzuru nke ka ojo mamini na dibusha uzo onwo ngbudu mini mo onwo ngbeji po onwo yin meje na eme na po na osi aminede na wa magabia tano ni dipwe kwa idu onyo bu nyikoru elu ngakwari ya mini enyikoro elu ya bụrụ ihe na-ewute anyị ọ na-ewute anyị nkajaga na-emiere ụzọ n'ụzọ ya na-agba ma ọkọchị ma udu mmiri arụara ya ọjọọ dị anyị obodo maka na ihe agba ohu ma nwaanyị ma nwoke na-akwekwa maka na enwe na-abịa every Monday aya like gị a ehụ ọdị enwe ya onwe onye uhu kasịrị ikejeje akpọ ụmụ nkeja akpọ na osi na wanọganọ.
I am begging Make Health Campaign team to help total government to help us. We want to develop like other communities.
Nke mbụ kachasị mkpa bụ mini anyị nwogu mini na ibie maka mini nwere hụ amụrụ nwa ọnụ mini bụ ihe ji na-asaga na-asụchaga ihe then ọkụ anyị nwere ọkụ eji ọmụnwa na-ewere torchlight na-agbagharị ndị na-amụnwa ehụnwa ekwuru mbụ ụnọ m na-abịa wuo na ni complain kwanụ na ọ dịghị dọkịta nọ ni ihu n'ụlọ tọgbọrọ ni ihe bụ n'ụlọ I need more nurses and doctor.
So for now, our constraint is majorly on toilet because we have not dug the pit for toilet and ceiling. We have not done it. Window, we have not done it. So actually, we need help from government to make sure the health center works as other health centers is working.
Aka ha mụ na-ekele ekele unu bụ na aka je hite na unu ande unu bịara nke mbụ unu vutere ihe niile unu bịa nke ebe unu vutere bed unu vutere ihe min unu vi ihe dị iche vutere
Talk Niger, they opened our eyes to see some of the things we needed to have in this center, and they have made some provisions. They are too numerous for me to mention here.
When we met last year, we were able to form the various committees through the directive of the Dr. Nance as his team came to us. Really, the allogy and descriptions and adjectivization of the name given to it make our hospital work is reality. Because it's there, the lot of change for good. Our hospital development, the health post in Amata has started working to our great surprise. Because he taught us the role of the committee, the role of the community, the role of various committees that handle the health, their positions, and what they should do to make our hospital work.
Since the formation of the committee, we have been able to sensitize the people on the issue of health in collaboration with Talk Health Niger and other relevant agencies that have been visiting us. Since the last time you people came, it was really a morale booster because a lot of people were invited during their last visit. And when they came, it helped us in mobilizing the women, the community at large. Then the moment you people left, we hired the town crier who invited the whole community for a brief discussion on the last visit and the outcome of the last visit, which helped the health center to be a busy one of late.
Talk Health Niger has given us some dividends that we need here in the health center, and they have helped again to make sure that people knows about this health center. And there are many other things. Even the improvements, we have made many improvements here.
The health committee had started 10 years before now. So, but in those years back, there was nothing like Talk Health Niger. So if not for the last year that they came visiting us, sensitizing us, so we like woke up from our slumber and said, okay, so government and even the community can assist in this. So since then, we've not been lagging behind.
The message is I have for you people is now is electioneering period. We want you people at least to talk to our politicians, the government, and public spirited individuals to help us to make sure that the health center is working. For the little ones you people have done, we thank you immensely. We are grateful.
na akparịkọta ụka maka ahụike na makụzikwara anyị gegeji se ọrụ gị man anyị na-ekenesi ha ike na-asọ se ha jisikwara ike n'ọrụ ha.
Those activities that you saw and the testimonials, many of them very encouraging, did not just happen. Our theory of change on this project was the fact that when citizens are educated, when community leaders have information, when they are aware of existing health policies, when they are aware of their powers, they are more likely to take actions. And when they take those actions and the results of their actions are given visibility, it motivates them to do more. Were we able to achieve that? I think the answer is yes. And what did we do on the project? We started a radio program, Talk Health Nigeria radio program, on Unity 101.5 FM Abakaliki. What were other sensitization activities? We had vehicles that went through communities, drove around communities in Ohozara and Afikpo, North local government areas of Ebonyi State, which were like our focal LGAs for this, the purpose of this intervention. They spoke in the local dialect with messages that were pre-recorded, describing the roles of communities in primary health care. The results we've got on this project is made possible by the excellent team we had in Talk Health Nigeria, as well as the highly motivated volunteers, very inspiring, highly passionate persons in Ebonyi State who lent their time without any pay, worked in their communities, and made sure that progress is achieved. At the beginning of the project, we're having weekly meetings, which later became bi-weekly meetings, utilizing technology, having Zoom calls, with hybrid meetings with the involvement of our team in Ebonyi State, brainstorming, learning lessons, as well as modifying our strategies to make sure we get the best outcomes.
And within the past 1 year, we have been able to, with the sponsorship of Open Society Initiative for West Africa, and Talk Health Nigeria, we've been organizing, running the projects in Ebonyi State, the Ebonyi State SPAC project. And so far so good. The project has really been a success. Seeing people get the best of primary health care in their places, seeing increase the community participation and involvement, strengthening the governance structure of primary health care in our focus local governments. It's something that is worthwhile.
I've been able to discover that once you make up your mind to do something and you work towards it with the right people in place, you're definitely going to get things done the right way. So I was here ensuring that everything, all the documentations are done in compliance, so that when auditors come and they will get to see that everything was in place and everything was done the way it was supposed to be. Just the way we have our initial approval after the first tranche, I got a clean bill after the auditors went through the report before the second tranche was released for us to move further with this project.
The project was really an interesting one for me. It gave me an enlightenment into the NGO activity, being in the field and also always in the office, communicating with those in the field. Opened my eyes and understanding to the activities that has to do with the hospital and strengthening the primary health care. Yes, it also gave me more insight into what the state of the Nigerian health sector is really like. Yes, the primary health care, which is the closest or the most closest to the people, is being abandoned. by the government and the people. But through this project, we made the communities to realize that as a community, they also have a role to play through the village health committee that they have to set up.
Being a part of the campaign is one of the best things that happened to me this year, because I've learned a lot. Since last year, I've been with the campaign to this very point in time. We have done so many things in the community, in the area of sensitization, because there are so many things going on in our hospitals and health centers that many of us, the citizens, we don't know. But through the campaign, we've been able to sensitize the people to know, especially their rights.
I started linking and talking to some persons, and thank God for some of them that listened to me in the community, which they started setting up a health committee. So far in Ugulangu, I've gone to so many villages, and all these villages that I've gone, some of them just, saw the need immediately and then set up the health committee.
When we started, it was like people were not turning out in mass. But today, it's a story. We have achieved a lot. We have tour around the whole Africa North. We have Amori, which we are just living now, Amori Oziza. We have been to Amangbala, Amoro, Ndibe, and Ameta Oza. These places are where we have done serious campaign, serious sensitization. When you contact people and you are telling them about health centers, they feel it's not a proper place for them to come when they have a health challenge. But after serious sensitization, now you can now boast of seeing people trooping into different health centers for their vaccinations and other things.
I see Make Our Hospital Work Campaign program as an eye-opener for the people to take fully what belongs to them, to make their health a standard one, to revamp the weakened and the dying hospital facilities, and then to save our people's life.
In summary, with support from the Open Society Initiative for West Africa, as well as the various communities that participated, members of the Make Our Hospital Work Campaign in Ebonyi State, and of course the management and staff of Talk Health Niger, year 2021 to 2022 was a turning point in the life of the villages and the communities that were able to reach in Ebonyi State. Apart from the ones that you just watched and we just talked about, there are a number of other communities that have scheduled activities from January 2023 that they plan to implement when they have their community meetings and town halls to begin to take additional actions in primary health care. So we are proud that through our effort, we're able to reach at least 14 communities in both LGAs. We're able to inspire the establishment of at least 8 new village health committees. We reached hundreds of thousands of Ebonyi people with messages using the 48 episodes on Talk Health Niger radio show and social media as well as television to create more awareness even beyond Ebonyi State on the importance of community participation in primary health care. We were able to distribute personal protective equipment and trained officers in charge of health facilities on COVID-19 prevention and the need for people to take the COVID-19 vaccines. We were also able to clear the doubt of persons who feel that they had no role to play, and community leaders were able to understand that when they get more involved in primary health care, things begin to move faster. This is not the end, it's just the beginning. And we do hope that as the campaign continues, the success stories will continue.